What we've talked about so far, if I understand correctly, these trials that you mentioned, they did not include brain metastasis, correct?
So this is partly correct because for most of the clinical trials, especially the large phase 3 trials, exclude patients usually that have progressing or what we say active brain metastases, meaning if they have brain metastases, they are not stable, that are not being stabilized with radiotherapy or some other treatment. And so in general, since it's very hard to predict, it was very hard to predict the behavior of these diseases. Usually patients with unstable brain metastases were excluded from the trials, although this is changing now and more clinical trials are enrolling also patients with brain metastases. However, some patients in these trials were included if they had stable brain metastases. So brain metastases that either were treated with radiation treatment or if they were treated with systemic treatments and they were not progressing. And so we derived some very important data from these studies. And let me show you some of this data. So we already discussed what these waterfall plots are. So if you see a line going down, it means that the drug was effective in that patient at shrinking the disease. And what you can see on the left is TDM1. It's an old conjugate that we still use. It's also called Kadcyla, and it also targets HER2. And it was tested in patients with brain metastases, and it was kind of effective. But you can see that there are both lines going down and lines going up. But what you can see is that in the middle and on the right are two trials of TDXD. TDXD for patients with HER2 positive metastatic breast cancer that had stable brain metastases. So brain metastases that were there, but were not progressing where the patient started the treatment. And what you can see is that most of the patients treated with TDXD experiment a shrinkage of the brain lesions. And so the drug can penetrate and can work in the brain, in brain metastases. And this was very important to see in Destiny Breast 01 and Destiny Breast 03 trials. But then what happened is that, of course, we asked ourselves, could this drug also work in unstable, in active brain metastases, in patients that unfortunately have a progression from this brain metastasis and need some treatment right away? And so we started developing specific trials dedicated to answering this question. And two important trials are the one on the left and the one on the right. The one on the left is called Tuxedo, and it's a trial of TDXD for patients that have HER2 positive metastatic breast cancer and active progressing brain metastases. So brain metastases that were previously treated, but regardless of treatment, they're still moving and progressing. And what we saw is that TDXD was very effective at shrinking the disease. And so there was a very high response, intracranial response rate, we say, for these patients. And the same thing was observed on the right in another trial called Debra. And also in the middle, this was an effort we did at Dana-Farber together with Duke and MD Anderson to see not in clinical trials, but in patients treated in real life, if we see the same. And we actually did see the same. So the wide majority of the patients with HER2 positive breast cancer that received treatment with TDX3 have a shrinkage, have a benefit from this treatment. And of course, this is HER2 positive.